Hi, everyone. I think we are live now. It's great to see people coming on. Attendees are joining. Okay, now we're seeing, and we are going to give everyone, hi, everyone. I see some familiar names logging in. So my name is Krista Martel. I am the Executive Director of the Well Project, and we want to welcome you to our webinar in honor of National Women and Girls HIV Awareness Day, otherwise known as NWGHAAD or something to that effect. The webinar is called the Well Project Unplugged. Let's talk about women and HIV. And we are really just going to be kind of hearing from a bunch of our community advisory board members, and talking about some different topics that we looked at in our recent survey. We'll be doing some poll questions to just kind of get your, your kind of answers to some of the questions that we're going to be covering. And then in the process of looking at some of these topics, we're going to hear from the CAD members about, some of their experiences on these topics. We want to hear from you, so please use the chat to communicate with each other and engage. You can also put questions there for the panelists, which we're going to answer at the end for the most part, but during the chat, people will also be able to communicate, or if it's something to respond to. There's also the Q&A, so you can put a question in the Q&A. So we are going to get going because we have a lot to talk about and we want to hear from everyone. So welcome. All right, now go. So I just kind of gave the introduction. Some of the survey highlights and experiences that we're going to hear from everyone on include stigma, both in kind of personal lives as well as in healthcare settings, and also around self-stigma. We're also going to be talking a little bit and hearing about, well, we're just going to talk about concurrent health conditions and kind of see the prevalence and how prevalent that is amongst women living with HIV. We're actually going to probably not cover that in depth amongst the CAB members because we feel like that's a topic that deserves a whole webinar and that we could go into a lot of more detail on that. So we will be tackling that topic in the future. We are going to cover a little bit about barriers to accessing mental health care, and kind of tied into that, how people, what types of self-care methods they use in order to keep themselves well. And we're also going to talk a little bit about U equals U. And also, like I mentioned, we'll be wanting to hear questions that you have for the CAB members, any questions you have around these topics. And with that, we'll keep going. So hopefully most of you are familiar with the Well Project, but we are a nonprofit organization with a mission to change the course of the HIV/AIDS pandemic through a unique and comprehensive focus on women and girls. We've been going since 2002, and we largely leverage technology to really try and improve health outcomes and increase the quality of life for women and girls living with HIV. And we do that by focusing on providing education and information through our library of fact sheets in English and Spanish, and some in Hindi, which are ever growing, through community support, which kind of grew out of the A Girl Like Me blog, which many of the women, or all of them, I think, that are part of our community advisory board, kind of a lot of them started with A Girl Like Me and grew into their roles now part of our CAB. And through that, we've helped with doing some advocacy training and leadership development. We're very focused on collaborative engagement and working with other organizations on how we can kind of not recreate the wheel, and also work together to, kind of strengthen each other's work. And lastly, we focus on women-focused HIV research, which is an area that, women have always kind of been underrepresented in HIV research, and we do that largely through our Women's Research Initiative on HIV/AIDS. So you can find everything that I just spoke about at our website. And WATCH stands for Women's Advocacy and Treatment Coalition on HIV, and it's an ongoing HIV treatment and advocacy / capacity building webinar series, and we've been doing this for about 5 years and tackling a variety of topics. And again, a lot of the topics we were covering throughout the years have been coming to us from you, the community members, telling us what you want to know more about or hear more on, and then also from our CAD members to inform, you know, the topics that they're hearing people want to know more about as well. There's a little bit of feedback, and I'm hoping it's not me. If you're not speaking, if you're a panelist and you're not speaking, if you want to mute, and until it's time to speak. Then just so you know, this webinar is recorded and we post them to YouTube and they're on our website as well. And this will last about 90 minutes. And again, a Q&A at the end. Use the live chat box, and that is that. Lastly, just as we mentioned, today is National Women and Girls HIV/AIDS Awareness Day, which takes place every March 10th, and it's an annual nationwide observance that sheds light on the impact that HIV has on women and girls. And so this initiative is supported by the Office of Women's Health, and it encourages federal and national and local organizations to kind of come together and increase awareness around the importance of prevention, care, and treatment for women and girls. And so there's a link there if you are interested in hearing more events. So quickly, I'm gonna end soon. We will be covering some data from our recent survey that was, and the data that we're covering is really just focused on the responses from women living with HIV. The survey is found on our website, and it's called Together We Are, Making an Impact, and it was really about kind of both the experiences of living with HIV as well as the Well Project's impact with our programming. And so we've showed that, you know, in the survey we're seeing that, you know, there's significant progress that we've made over the years, but then we're still facing numerous challenges and obstacles for largely, you know, I mean, from the women that we heard from, largely their treatment, you know, had a lot of treatment success in terms of reaching undetectable viral loads and managing that part, but you know, there's the issues outside of that you know, we're going to kind of cover today. And so yeah, this is just kind of the latest of the ongoing surveys that we have to just really make sure that our programs are meeting the needs of women, you know, across the globe. Okay, so so if you just joined, my name is Krista. I'm the Executive Director of the Well Project, and now I'm going to ask each of the panelists in alphabetical order to just introduce themselves and kind of maybe touch upon, you know, one or two key things that, you know, you're thinking about in terms of National Women and Girls HIV Awareness Day that you want to just kind of shed some light on, whether progress or obstacles that you're hoping to tackle. So first, I will introduce Gina Brown.
Hey, how y'all doing? I'm Gina from New Orleans. I'm the Community Engagement Manager at the Southern AIDS Coalition and a Community Advisory Board member of the Well Project. I also attend the WRI, which is another meeting that the Well Project puts on. On this National Women and Girls HIV/AIDS Awareness Day, I've been thinking a lot about the fact that we still have to have these days. You know, as we move forward, I want to be more mindful of the fact that it's all about putting the word out there so no other woman will hear the words that I heard almost 26 years ago, you know, that you're living with HIV. And I'm so happy that we're having this discussion today about stigma. It means a lot to me. Thank you.
Thank you, Gina. Next, Cece.
All right, let's see. Hey, y'all. So I'm Ciarra, but I go by Cece. And I am thinking a lot on this day. My diagnosis is almost 12 years ago now. It's early in my 20s, matter of fact, 20. So it's been most of my adulthood that I've been dealing with this virus. And as Ms. Brown just said, like, I would like for no one else to have to experience that diagnosis. And if that point has already happened, then I just want us to, you know, that internal stigma is what I deal with the most. For me, HIV is more of a psychological thing. So understanding that, that is the way that I kind of approach my advocacy work, which is mainly online. If you've heard of Healing is Voluntary, that's me. So I don't know. Hey, y'all.
Thank you. And next, Porchia.
Okay. Hi,
Yep.
guys. My name's Porchia Dees. And I am a HIV Prevention Specialist for an organization called APLA Health. I am also now the new CAP member for the Well Project. I've been living with HIV for my whole entire life, for 33 years now. And I think for me, like, what I am thinking in regards to National Women in HIV and AIDS Awareness Day is how back then, I feel like my mom still would have been here if she would have had the services she needed and would have been able to reach out and get support. And, you know, back then there were no services for women in the HIV and AIDS field, yes. And it hasn't too much changed. And I don't understand that there's still not a lot of services for women. So I'm super grateful that you are doing this, Krista, and that your organization is geared toward us and for us. And yeah, I'm happy to be here.
We're happy to have you. And yes, just a quick note, Ciarra and Porchia are new community advisory board members for the Well Project, and we're super happy to welcome them. So thank you. Okay, next is the famous and beautiful Ariana Lynch.
Hello, everybody. My name is Ariana Lynch. I am the CEO founder of Ariana Center. Also, I am a board member and a blogger of the Well Project and the program Una Chica Como Yo, or A Girl Like Me. And also, I work with very close with the Well Project, specific in the southern region in United States, from Atlanta, Houston, Dallas, Texas, New Orleans, and also Puerto Rico, and empower the leadership of transgender women, trans-Latinas women living with HIV, and break the stigma. And for me, it's a pleasure to join this panel with these amazing women who I know each of them, and I know how hard and how my heroes they are, because they are very have a commitment and erase and disappear the HIV. And for a trans-Latina person, also I am I'm one of the first ambassadors for the You Equal You campaign, and I know how important it is break the stigma with different tools, and You Equal You is one of the bigger tools for transgender or for people living with HIV and empower themselves and their health. You know, so thank you so much, and I always so happy to join and share room with the Well Project, because from the bottom of my heart, the Well Project is one of the organizations key in my development, in my career development, in my advocacy development, and in my entire personal life development. So thank you so much to each of the persons who they are from the Well Project.
Oh, thank you. I mean, thank you. And we love each and every one of you. I'm so grateful to have you all here. I know there's a lot going on today, but so without further ado, I'm going to hand it over to Maria, who is one of our very first Girl Like Me bloggers and an original CAD member and also a global ambassador.
Thank you, Krista. Hello, everyone. Good afternoon and good morning for those that, or even good evening for many that are around the world. Very honored to be here with all of you. Very excited, and then that we have survived another, Women and Girls HIV/AIDS Awareness Month, which I do believe it should be every day because we're living with this every day. And for me, it's for what I have seen throughout the years. It is very important that we continue showing our faces to take the stigma away. I started with the Well Project 10 years ago, I think approximately, as a volunteer. And because as I believe Porchia mentioned, there's nothing, absolutely nothing for women out there. Obviously, I'm a member of PW and as well, but they're more policy. And the Well Project is very organic, and it's a great sisterhood. I'm a very proud to be there. A global one of their global ambassadors, also a CAB member, as Krista mentioned from the beginning, which is so important. That they always include us and practice MIPA, which is very, very, very important for me. I'm also one of the co-founders of the Latin Plus, which is one of the first, well, actually the first national network for people living with HIV of Latin, that are Latinx. Also in the National International Steering Committee of U = U, and one of the first ambassadors as well, that we got trained. And being a part of all these campaigns throughout all these 24 years of my activism. I'm almost a 32-year long-term survivor. And this April, it was God's will, turned 47. And another more year. It's not an easy thing. As I tell people, it's not a death sentence anymore, but it is a life sentence. And with that, I'm not trying to be negative, but we had a lot of work to do, especially with the new generation. Because I will speak on this later on, but I am I'm kind of like mortified with what I'm seeing with these apps. How people don't even want to use condoms, and they specify it, and they say if someone says I want to use a condom, they'll no, I'm not interested, or something like that. What is going on? They know that HIV is out there. They know that all these STIs are out there with resistance. So all these webinars are very important for us to discuss. Plus what Krista mentioned as well, research on women is then being done. Why? We have to, like Gina told me in one of our talks with all of us, we have to make ourselves be included. We have to pretty much force it, and that's what I plan to do, and what we all plan to do, because we are not going to be left behind anymore. Thank you.
Thank you, Maria. Super important topics, and also ones, especially the research is something we also plan to really get more deep into on a future webinar, and kind of building awareness around clinical trials and how women can be more active in the research design. So, and next I will also introduce Bose, who has also been with us since I think was first on an advisory board in 2011. Then became a blogger and eventually a community advisory board member, and then also a global ambassador based in Nigeria.
Evening, greetings from Nigeria. My name is Bose Olutu, and it's a great privilege to be here with you and seeing all the smiling faces. I am most delighted, and for me, it has been quite a journey working with the Well Project. Long time I've been in Nigeria as an advocate and an activist for treatment access for women and children infected by HIV. And I've been working on the field of HIV for almost 20 years. But working with the Well Project has really, really built my capacity in many ways. In the area of advocacy, in the area of community outreach, and being a global ambassador for the Well Project has really, really taken me far. because what I do personally is I take HIV health education to schools, to secondary schools in Nigeria, in Lagos, and in Abuja. And it's amazing how you reach these young ones that does not have access to internet where they can source for information by themselves. And it's so funny that even here in Nigeria, as I'm sitting down talking to you, I don't know when the internet can just go AY. So any moment from now, it can just zap off. It's like that here. And I know there are a lot of young women and girls out there that does not have access to information. So the Well Project has really helped to empower a lot of women at the grassroots community level where they don't have access to information. Sharing of this material, some materials I get from the Well Project has really, really gone a long way to help women. And it's still amazing that people are still coming down with the AIDS symptoms. People are still dying of AIDS-related disease here in this part of the world. And statistics showed in some conferences that sub-Saharan African young adolescents are getting new infection of this virus. So for me, as a global ambassador, as a CAP member, one of my responsibilities and giving back to my community is to reach out to these young women at that grassroots community level. So it's nice to meet every one of you. I am most delighted and happy to see all of you. Thank you.
Thank you, Bose. And yeah, if you ever get a chance to go to the blog and look up Bose's blog, you'll see her standing in fields of young students around Nigeria and Abuja and Lagos, as she said. And it's she's been reaching out to young girls and pregnant women across the country for several years, reaching a lot of people. And last but not least at all is Winona Thomas.
Hello, everyone. Like she said, my name is Winona Thomas. A lot of people know me as Nunu. I am the CEO and founder of Living Your Truth, which is a multi-platform that's focused on empowering and inspiring individuals in a life of recovery from diagnosis of life-changing health conditions and or tragedies and traumas. I am a CAB member, as well as a Girl Like Me blogger. I'm also a U=U ambassador, as well as their steering committee. I'm also an ambassador for an organization called Youth Across Borders. And one of the main things for me that I really truly appreciate and am more grateful for the Well Project for holding this for National Women and Girls HIV/AIDS Awareness Day is for the simple fact that I've only been diagnosed with HIV for 3 years, so I'm still considered newly. And the fact that our now generation of millennials and Gen Z are less informed about the basics of sex and transmission, and the fact that they're not being aware of healthy sex practices, and the fact that the youth are becoming more impacted by this virus, or this epidemic that we say. So I feel this is very important, especially for someone like me who is young and newly diagnosed, and didn't have this available when I first got diagnosed. And I'm pretty sure for a lot of others, are long-term survivors. So I just want to thank everybody who are tuned in, and for those who are participating in this webinar. It is very essential, not only for, like I said, someone of my extent, but for many others and generations to come.
Awesome, thank you. Yeah, and as you can see, one of the really beautiful parts of the Well Project being kind of an online resource. I mean, we do a lot in person as well, but kind of starting out as an online resource and a girl like me is the diversity that it allows people from, all different, areas and like geographic and just ages and experiences to come together and find mutual ground through their experiences living with HIV and being women. And so it's really created this kind of online sisterhood. So if you aren't you know, visiting A Girl Like Me, there's a Girl Like Me group that you can follow on our website, and that gives you a notification every time a new blog comes out. I highly encourage you to do so. And we have a lot of A Girl Like Me bloggers and also some other CAB members who are part of the webinar as well that are on the attendees. Okay, so we have a lot to cover. So thank you all for covering all of those different topics and telling people about who you are, and we're going to move on. So I think the next thing is a poll question, and I'm going to bring up the poll. This is anonymous. There's no wrong answer. It's largely for women living with HIV to respond to, but if you know, you're welcome to participate and just say not applicable if you're not a person living with HIV, and if you're a man living with HIV, please answer as well. So let me see if I can pull this up. Okay, okay. So have you experienced HIV stigma in your personal life? If yes, choose all that apply. And we'll give just a couple minutes. I'm not entirely sure if you all can see the responses, but maybe when I finish the polling. Okay, I'm going to give it just
We
a few
can't,
more
I can't
seconds.
see it.
Okay, you can't see the responses. Okay, so hopefully once closed, I think it should. So I'm going to go ahead and close this and share results. Okay, so 44% from family members, 28% from friends, 16% in the neighborhood, 16% at work, 34% with a romantic partner, 38% other, because we didn't include all the various, and then several said not applicable. So, all right. So now I'm going to close this. And so this is a graphic from our recent survey, and you know, as you can see, it kind of mimics a little bit of what we were talking about, that a lot of from family and friends, and we also, and also just at the top is kind of out of the number of women that, you know, responded to, you know, if they experienced stigma in their personal lives, you know, almost 70% said they did, and then from there they chose the different areas. So 70% is quite high, as you all know. Maria said you can't see anything. Were you able to see the polling questions at the end?
Yes,
Yes.
I was.
Okay, all right, great. Okay, so here's now, I'm going to hand it over. I know, Porchia, you were gonna talk a little bit about some of the stigma you've experienced in your personal life.
Okay, I mean, so I've experienced a lot of stigma, but I think I'm just gonna talk about one thing that I've noticed specifically. So you guys already know I was born positive, so my story's like a little bit different. My aunt and uncle raised me because my mom was on drugs, and you know, for me, my diagnosis was given to my parents, not to me initially. So I've been blessed to my family, my aunt and uncle raising me, they never treated me any different. And so I've been blessed to have that. I know everybody's story isn't like that they have received stigma from their family, you know? But I didn't start experiencing stigma until I got older, and until I started going, or I guess learning about sex and getting into middle school and high school. that's when I started realizing that there was a stigma surrounded by my experience. Because as a child, I think it was treated like I was, you know, living with a terminally ill disease, or it was a terminally ill sickness, you know. And I went to a really great children's hospital, and I was always involved in different like Ronald McDonald events and different like camps and stuff like that. So I was used to being around people who were sick or fighting an illness. And, you know, I just thought some people were sick and some people weren't. And I didn't realize there was this huge stigma surrounded by my experience until I got older. And when I started going through puberty, and when I got into middle school, I remember the first person that sat down and talked to me and told me that I have HIV, and then gave me like an HIV 101 after that, was my social worker at Children's Hospital. And I think I was in the 6th grade. And I mean, she didn't say directly that I couldn't have sex or I couldn't have babies, but the way in which she explained my experience to me and taught it to me made me feel that way. And then when I got into middle school and I took sexual health education, the way in which they taught sexual health to us and taught us about HIV and all the other STIs was from a very negative perspective. And it made me feel that if someone gets HIV, they're gonna die. If you have sex, you can get HIV, or you can get all these other scary, nasty STIs. And if you get HIV, you're gonna die. They only showed pictures of people who were really sick and dying, like wasting away. They didn't show pictures of people who were living. So I felt in the way that sexual health education was taught to me back then in the 90s, I think it was in the 90s when I was in middle school, was very negative. And that's where I felt the stigma, where it came from. And, you know, that disseminated throughout the whole classroom. Like, that's when I remember hearing all these like negative comments and stuff about HIV and the other STIs. And when I started learning about sex and learning about other STIs and sexual health.
Thank you. Yeah, I think, you know, for many to understand kind of, you know, when you're dealing with, I mean, I just taking HIV out of the equation, going through middle school and high school and puberty and sex and, you know, all of that is kind of difficult in itself. And then when you add HIV into the equation and kind of, you know, having people understand how complex that must be. So thank you for sharing. Porchia is the only one I had to respond to that. I know I had a question mark for Ariana, but does anyone else want to chime in real quick before we move on to the next?
Well, this is Maria, and so one of my main things has been to, like I said, combat stigma, not only nationally but internationally. Since the beginning, I've always believed that I don't focus on one specific group, although I am a very proud Latinx woman, cisgender woman. This is a human condition, as the word of our condition says. And it's very unfortunate that we continue to have stigma. And this is a fact and a reality. And many times these campaigns, although I'm an ambassador for many of them, Greater Than AIDS, CDC, and it goes on and on and on. Why? Because specifically in my community, cisgender women do not want to show their faces. And the heterosexual men, let's just put them as that don't want to come out because they're going to be labeled as gay. A lot of these campaigns, and this is nothing against any community, obviously I am pansexual, everybody knows my history, or many. But recently I have found myself, I don't know why, behind the scenes I'm working a lot, but these campaigns that they're heterosexual men and women, and they're willing to put their souls out there and show their faces. Very few, but you know, it's so when you get someone that is not me, because I'm tired of seeing my face, You know, that's the truth. You know, the places and the campaigns themselves tell them, oh, well, we would love to have you in our campaign, but we're going to use your images as MSM. They say this to for example, to the heterosexual males, that, you know, that they describe themselves as that. And also the cisgender women, and they get very frustrated because, and I get very frustrated because although, yes, the highest affected communities are women of color and trans women specifically, and MSM, but we have to understand that if we continue to just use that to describe us as only a certain group, this is a disservice that we're doing to everyone and to ourselves, because what do they continue thinking? That this is a condition for only people that are gay. And that's the fact and the reality, because they don't even know how to, that a trans woman, for example, is not MSM. Until recently, they changed all that in the CDC with the great help of Ariana and many trans women that are amazing activists and allies. You know, so if you have these people on top, you know, and these campaigns telling the people that are willing to go out there to show another group, a very important group that is lost as well, you know, and they're like, oh, well, but we're not going to put you as heterosexual. We're going to put you as MSM to a male that doesn't describe themselves as that, or doesn't identifies themselves as that way, or a cisgender woman that doesn't identify themselves as maybe bisexual, or even putting them as a trans woman without being a trans woman. Okay, this is something to me that is disgusting, and we also have to fight it. And sometimes we have to decline certain things because they're irresponsible, and that's why the stigma continues. And not only we would think in the United States and in places like New York, LA, and stuff like that, yeah, there's more information and everything. But you know, in rural America, in the suburbs, and in Latin America, and many places, Africa, Asia, some people don't even know what HIV means. Right. And that's why we have to continue being relentless and pushing through.
Yeah, thank you, Maria. I want to add something else too, like to add on to kind of what I was saying. Like, for me, I felt like what I was missing, it was very important that me as a child, that I received sexual health education, and that it was inclusive of our experience, and it wasn't. And I think that still to this day, sometimes it's not very inclusive of our experience. Like, so that's for me as a sexual health educator. And when I go out and teach, you know, teach the kids, the high school students, and anyone about HIV and STDs, that I'm inclusive of people living with HIV or other STDs. Like, it's very important to talk about treatment and how treatment works, even though I know back then we weren't where we are today with the whole U=U stuff and all that. But it's very important to talk about how treatment works and how people living with HIV or with any other STI can still have normal, healthy sex lives, still are worthy of love, so that's
well, and I think to what both of you are saying, that so much of the stigma kind of is based off of, you know, like education, not education, you know, poor education or ignorance, or the myths and stereotypes that still exist, and, you know, and whether that's in sex education or who can get HIV and all these different things. And that's why, you know, kind of disseminating factual information and continuing to work on, you know, health and sex education in schools and youth, so that we're starting, you know, early to kind of break down some of these myths is so critical to kind of battling stigma. But we're having not a lot of success in kind of how we've been able to move that needle over the past 30 years. And so I'm going to move to our next topic so we can make sure we can cover everything. But, you know, so the next topic, or the next poll that we're going to do, which is, you know, when we're talking about education and myths and misinformation, you know, we think that when we're going into the healthcare setting that they have all the information, and so there should be less stigma. So So the next question is, have you experienced HIV stigma in a healthcare setting?
Stigma in healthcare setting. Who has that? I'm
Yeah.
sorry, Krista.
Yeah, so the poll is, you know, we're just doing yes, no, and then I don't recall or not applicable. So
I don't see it, unfortunately.
Okay.
It says poll in
we're doing
progress. Okay, got it.
Okay, so I'm going to give it just another 10 seconds, and then we will show the results of the poll. Looks like we have about 2/3 of people who voted so far. Okay, I'm going to end the poll, and so almost 60% said yes, and 30% it's not applicable. So, you know, out of 72, is that right? What's my math? Anyway, no, 70%. Out of 70%, almost, you know, 58% said yes, and 6% said no, and 6% said they don't recall. So I'm not sharing this results. I thought I was. I'm sorry. Here you go. Now you can see the results that I just was so eloquently sharing. So again, that's a pretty huge number. So I'm going to then move here to our next, I'm sorry, I didn't put that up. So this is from our survey. And so here at the top, you see 61% of women reportedly experiencing stigma in a healthcare setting. And then you see the different breakdowns of, you know, percentages and with nurses and nurse practitioners, with healthcare staff, which a lot of times, and that's been a high percentage in other surveys as well. That's a lot of times that's kind of the front desk staff in healthcare settings, in ERs, with dentists, a little bit, you know, lower percentage with primary care physicians and OBGYNs, and then you can see some of the others. But yeah, so it's a very prevalent, and so I'm going to ask Gina was going to talk a little bit about her experience of stigma in healthcare setting.
Yes. So in 1994, I was pregnant with my daughter, and I was newly diagnosed. I had been diagnosed at April, I'm sorry. So this was November, and I was in labor. The lady had me on the elevator, bringing me to labor and delivery. And this guy gets on the elevator, and she takes my paperwork, and she puts it in front of his face. And he says, "What a waste." So she disclosed my HIV status to this guy. It didn't get any better. I get up to labor and delivery, and the nurses were talking about me so bad in the lobby, in the hall, that a housekeeper walked into my room and picked my chart up and started reading it. And I got really upset about that. When I delivered my daughter, after all of this traumatic stuff happening, leading up to me delivering her, when I delivered her, they put me in a room at the end of the hall, and no one ever came in my room. They never cleaned my room. They would bring my food, and they would put it on a tray in front of the door and knock on the door and walk away. I had to get out the bed, get the food, bring it in the room. When I finished with it, I had to put it back on the tray and stick it outside. Only one nurse ever came in my room, and I'll never forget her. Her name was Belinda, and her husband was a pastor. And she told me the first time she met me, that she laid hands on my baby and prayed for my baby. And I felt really comfortable with this woman, even though I'm not a prayer, y'all. I'm not. But I felt comfortable with her because she was the first person to show compassion. She was the first person to treat me as if I was human. Leading up to that, I never felt human after my diagnosis. You know, some of y'all know my story. When I was diagnosed in 1994, I wasn't told that I had HIV. The nurse looked at me and she said, "You have AIDS and you're gonna die." And that was the beginning of my journey. My journey started with stigma. My journey started with discrimination, and my journey started with misinformation. I had another nurse come and tell me, that if I did 3 things, I could live. So she was like number one, that was on my side. Then I went to deliver my daughter, and then I got this other nurse. And for a long time, I did not trust the healthcare field because of that. I went to the doctor, I took my meds, but I didn't say anything. Nobody else knew when something was going on with me because I kept everything inside. Because we know that when it comes to stigma, even though we deal with a lot of external stigma, I felt some internalized stigma also because of the experiences I was having and things that was going on. I remember when I delivered my daughter and they took me to my room. Normally when they take you to your room, they transport you from the chair to the bed. It's like really, oh my goodness, she just had a baby, let's take care of her. No. It was everything, do it on your own. Nobody wanted to touch me, nobody wanted to. And that was really, that was one of those things that really tore me up for a long time. Remembering that experience. And even now today, almost 26 years later, y'all, I still feel that shame and that guilt, because that's how I was made to feel because I was pregnant. How dare you get pregnant and you're living with HIV? Nobody came out and said it, but it was always implied. So that was a huge.
Your baby?
I didn't hear you.
Did your baby, your son or your daughter, is he or she negative?
She is negative. I did a study, 076, and took the medication, and she's negative. And she's working in the field now, so I'm really proud of that. But she's dealt with her own stigma. People knowing my status and knowing I was pregnant with her and putting it on her too. So it was that whole thing. The medical stigma is that thing that can keep us out of care. I could have walked away and never went back. The way I was feeling. I wanted to, but I didn't want to give them the satisfaction. I think the best way I can make people mad is to keep living. So, so I've decided to do that. I just keep living. But yeah, stigma in a hospital or medical setting is a real thing.
Yeah.
We deal with it. I've even seen it in ASOs. For other people, I didn't experience, but I experienced it, but I saw it for other people and had to speak up on it. So once again, Krista, the Well Project, all the attendees and the presenters, thank y'all. Thank y'all so much for spending your National Women and Girls HIV/AIDS Awareness Day with me.
Oh, and thank you for sharing it with us. I mean, what you said rings true for so many. To have stigma in the healthcare setting is supposed to keep you well, and it actually turn people away and keep them out of, managing their HIV is kind of just mind-blowing that that's happening, but it's happening a lot. And, and that's why, we see, I think, and we've talked about this in other settings, but that issue of, having the people that are checking you in and getting you ready for your appointment, and the front desk being the front line of you accessing your healthcare, having a lot of stigma in that, area is a really key part that you don't hear a lot about, in terms of trying to educate so it's just something to keep in mind as we kind of work on where we focus efforts. So I know, and you started touching upon it a little bit, Gina, and we have a couple people that want to talk to it because I know it's a big topic, is self-stigma. And so I am going to launch another poll, and which is asking, have you experienced HIV self-stigma? And one answer is yes in the past. Yes, I still experience it today. No, I've not experienced self-stigma, not sure, or not applicable. And thank you for those who are commenting in the chat, because I think that's part of, you know, we want to share common experiences and talk about. Okay, I'm going to end the poll and share the results here. So the highest percentage is yes, I have in the past, of 42%. And 26 reporting still experiencing it today. 0% said that they've not experienced self-stigma. That's a pretty huge indicator of how prevalent this is. Just 1%, 3% said not sure, and then those who answered not applicable. Yeah, so as we can see, in our survey, about just around 2/3 of women reported experiencing self-stigma, and you know, these are just a few of the quotes that people left around this. That people are devaluing themselves, unworthy to ever find love or intimacy, and you know, it's a really important part of, you know, this disease and trying to break that down, because that can definitely interfere with, you know, wanting to take care of yourself. So, okay, I'm going to stop sharing these results and I'm going to hand it over to, first I'll hand it over to Ciarra. You're going to talk a little bit about this and how, you know, how you've addressed or, you know, experienced self-stigma, and then if anyone wants to talk a little bit about if the Well Project has had any impact on that and how, but that's not necessary.
Okay, so before I met the Well Project, I probably wasn't able to put a name on the feelings that I was having. But going through those bouts of times when I'm like beating myself up again, because of my diagnosis, it wasn't one that I got at birth. It was something that I did that caused my diagnosis. And so sometimes that brings on a lot of shame. And I'm one that's not just living with one STI. I contracted herpes after I contracted HIV. So dealing with that self-stigma in itself, like DAGCC, you knew better. Like you knew what to do because you got diagnosed with that one virus. But you know, so every day that pill is the reminder that I have this virus. I could forget all day up until it's time for me to take my pill, and then it's like, oh yeah, you are different. Or, you know, maybe someone else's stigma then rubbing off on me. So I would have like partners that would be okay with the virus at one time, and then another time they're not okay with it. So I'm like, okay, well, am I really worthy? Am I expecting too much of these other individuals? Oh gosh, self-stigma is a beast. It's a daily struggle for me. Some days are better than others. Like I've accepted my status, but still, like, what if I had worn that condom that time? What if I had been educated, you know, more properly before I began having sex? What if? And so I always leave a space for people that also feel that way. Well, the Well Project has helped me in that light, because I know I'm not the only person that feels that way. We, you know, you kind of want to put the big girl face on every day and make it seem like it's all right. But some days that is just not my truth. A lot of days that is not my truth. A lot of times, like, you know, if I get a cut in public and now I see my own blood, I tense up on the inside like, oh God, I mean, even though I'm undetectable, I still feel a certain type of way about my blood. Or sitting at the nail shop, sometimes I want to sit and tell these women, you know, because I do this whole healing is voluntary thing. So just talking about HIV awareness and trauma and all of that. But if I disclose to this lady in this nail shop, then maybe she'll feel a certain type of way that they're using the same, you know, instruments on me that they're using on them. Although you can't even, you know, HIV isn't spread that way. I'm still like, whoa. I'm always constantly having to check myself. And you see, I'm nervous. Like I'm even balling up now to talk about it because and it's hard because it's a lot of pressure put on me because the way that I give people this information about this virus is how they're going to respond to it. And some days I'm not feeling all light and beautiful about it. Some days I feel like I don't know what's going on. My lymph nodes is swelling up. I damn got rashes I don't know nothing about. Like, you know, I don't know. So that's where I'm at.
Thank you. Well, I mean, but, you know, I know you're feeling a lot of that, but, you know, if anyone doesn't follow CC on Instagram, you have to, because she's going to brighten up your day every single day, even though she may not be feeling that on the inside, but on the outside, she's basically going to make you smile. I thank you for always lifting up, you know, the positive. I mean, but, you know, obviously, and when you blog, and it's like, you know, sharing everything. So, and Porchia, I know you were going to talk a little bit about this too, and looks like Winona.
Okay, so I mean, like, I don't know how specifically to share this, but I'll try my best to articulate what I'm trying to say. So I remember my mom, my aunt who raised me, telling me like to be careful who I share my business with because people in this world could be cruel. This was when right before I went into high school. And of course I didn't listen. I had to learn, as all kids do, sometimes have to learn on their own. The first person I shared my status with, it ended up bringing us closer and we started dating. And then when we broke up, that person told my business to people and it started spreading around the whole school. And that's when I started like all these people talking about me and stuff. And I think, so for me, I felt like even some of my friends who didn't care about my status or whatever, but I felt like they were hating on me. Like, I like to think I'm an attractive woman or whatever. And I think people used to use my status against me in that sense. Like if I had this one friend and it really, really broke me down who, like she was my road dog, like, but one of those competition friends, like everything was always a competition with her, like. And I mean, she had been through a lot in life, just like I had. But like, she would tell my business to others, like less attractive, so they wouldn't like me no more, or wouldn't be attracted to me anymore. And then that kind of like, I kind of internalized all of that. Like sometimes it worked, and then sometimes it didn't. Like some people didn't care, and then some people it did make them stop talking to me or not be attracted to me more. And I started internalizing that to be like, okay, like I know I'm beautiful, I know I'm pretty, but I have HIV, so that makes me less like, even though I'm pretty or I'm beautiful, like I have it, I'm not nobody's known. And I started internalizing that and feeling like I wasn't worthy of love, or like I'm not beautiful or whatever.
You are beautiful.
Period.
Thank you.
I concur.
That's Cece?
No, I think that was Maria and Nunu.
Thank you. So yeah, people use
Period.
my stuff a lot. That's all I want to share.
Okay, this is Wanona, and I did briefly want to share too on self-stigma.
and mine's kind of tie in a little bit with healthcare. So for those that don't know, like I said, I've only been diagnosed now 3 years, and I got diagnosed while 4.5 months pregnant. And from the fact that my doctor, my specialist, didn't give me the full extent or the full information around U equals U, I went on ahead and consent to have my tubes tied, and that was due to being in fear of at that time when I got diagnosed, I didn't know whether or not my child was going to be positive or negative. And I mostly was going towards that since I was diagnosed with the baby, that I felt the baby was automatically going to be positive. And so this is something that I vocalized to my specialist and nurse practitioner as well. And this is the reason I gave of why I wanted my tubes tied, because I didn't want to go through what I already was going through mentally and physically with my unborn child. I really beat myself up, and I was so scared. I mean, I had it to the point where I already had somebody who was there for standby, who was willing to not necessarily adopt my child, but take my child to the point where it was going to be open, and whenever I felt the need or wanted to get my child back, I was going to be able to. She was there from the time I got diagnosed all the way up until my delivery. By the grace of God, I knew, I want to say maybe a month or two before delivery, that I wasn't going to need her, but she stood by my side just in case. And it had a lot to do with the fear of, or even just reading up on a lot of the myths that if I was to give birth to a positive child, my child was only going to be possibly living until the age of 10. And then I had the fear that if I gave my child away and I kept my other children, if that child made it past 10, they would have so many questions of why I kept my other children and not them. And so I blame a lot of that on, again, my specialist for not informing me of what U equals U was and the extent of it. And then also even like now, even being a U equals U ambassador, and I'm going to just be 100. Y'all know I live in my truth, and that's my whole business from jump anyway. But I still self-stigmatize, because even though I know all that I know and I do all that is need to be done to protect myself and others, I'm in a relationship now. I'm in a serodescendant or mixed status relationship. And even to this day, my biggest fear is I just pray I don't pass this virus on. I would not be able to live with that if I was to give it to someone else. And so again, I know I take my medicine. I know I'm undetectable, but one of the things that I talk about, and I talk about with amongst my community, is just the fact that I was just negative 3 months ago. And I was the same person who had only just the basics of HIV. And to be honest, to sit here and say, and I know it's a conversation we probably really need to have, even knowing now, if the shoe was on the other foot and if I was in my significant other's situation, I don't know how acceptable I would be to actually date somebody that's positive. And that's just being honest and knowing U equals U, knowing all of that information. And it's just, again, due to the fear that's in the back of our heads. And I mean, like I said, I'm not going to lie. Shit, if I was negative and I knew all that I knew, would I really be so easy to date somebody? And it's ironic to say, because us that are positive, we want to be loved. We want to be treated as if we're normal, and we are, but we just have an extra condition. And like I said, that's just something that I still battle with today. And I'm just going to be honest, because like I said, I feel it's a little ironic. I want to be loved. I love that my partner, he loves me. He forgets sometimes that I even am positive. But would I be able to be in that mind frame if the roles was in reverse? And so that's where I feel like I self-stigmatize myself. That's all.
We can't hear you, Krista. I
I
can't
can hear you. I thought it was my phone. I'm like,
sorry guys, I had mute on because it was typing. So, all right, well, thank you for your honesty. And I am going to move on to the next. We have a couple people that we still want to hear from, but the next thing, and we may have to scoot along, but then this slide that's up right now is just kind of talking a little bit about how, you know, engaging in the Well Project's resources, like both with getting information and kind of being surrounded by this amazing community of women and kind of lifting each other up and building advocacy and and the community support has had a positive impact. And, so one of the statistics we see is that, 74% said that they're more likely to experience less HIV self-stigma. So it's, so we just wanted to highlight that we do think just kind of engaging with other women living with HIV and kind of being more empowered with information and learning from each other has a really positive influence. So the next poll is, we're going to move on to, this is a statistic, actually. This is not related to the poll, but this is what I mentioned earlier. This is just something that we wanted to bring up and highlight in the study that we did, but just about 2/3 of women living with HIV indicated that they experienced other serious health conditions in addition to HIV. And again, we're not going to talk about this because this could take probably a full hour and a half to really dive into the different conditions that people are experiencing, and especially as women are aging, or long-term survivors, which include people born with HIV, managing multiple health issues. And so we just wanted to put that out there because we know it's a really serious, issue that we have to talk more about and address, and we will be doing so in, the coming months. So then the next question, the poll question, is also around mental health care, because we also did quite a few questions around women experiencing mental health issues and, past or current trauma. Again, that topic itself would be a whole kind of webinar in itself. So we're just going to focus on the statistic around experiencing barriers to accessing mental health care. And so this poll is, have you ever experienced barriers to accessing mental health care? And then, and we'll then just kind of talk briefly about, some people's experiences to, experiencing those barriers and why. Okay, so I'm going to end the poll, share the results. So the majority, almost 50% said yes, 30% said no, 14% said they never tried to access it, and 10% not applicable. So definitely, again, this is an area that is important, especially as we're looking, to not just work on the treatment aspect. And I mean, it's great if people achieve viral suppression and are able to manage their HIV, but then, not able to have a high quality of life, and mental health often plays a big part of that. So, so we just want to make sure that we're talking about this a little bit. And this is some of the statistics from the survey. Financial issues, long wait times to get into mental health, lack of access to mental health, professionals, and then also experiencing stigma from mental health professionals. And I know that so then I'm going to hand it over. I know Maria and Cece and Porchia, we're going to talk a little bit about this. If you guys can just keep in mind, we only have about 20 minutes left, and we have a couple more things to talk about and want to hear if there's any questions. So thank you. I'll hand it over. Maria, you haven't spoken for a little bit, so you want to jump in?
I mean, sure. Many of us have mental health, and that it's in itself has a lot of stigma as well. Especially from my background, the Latinx community, they believe that, especially the older ones, that if you ask to go to a psychiatrist or take medication for mental health or mental illness, that you're crazy, and they don't believe in therapy. They don't believe in none of that. So many of us have trauma from childhood and from our teenage years, period, even besides HIV. So we're dealing with that. Add into it, let's say for a long-term survivor, I was not born with HIV, was a teenager, 15 years old when I got HIV in 88. So you add a teenager that has trauma with sexual abuse and violence. You put in the mix HIV, AIDS, actually, like Gina, they also told me very in an unempathetic way, you have AIDS. You know, it's alone. I didn't know no one that had HIV. Social media didn't exist. I went back to Colombia, which was like going 20 years backwards in many ways. So I had to deal with this death sentence for a long time and not getting help, and years passed and seeing so much death. You know, I got survivor's guilt, PTSD, depression, anxiety, and I've written a lot about it, you know, and I have my good days and my bad days like we all do. But one of the things that I think we all have in common is that we are warriors, and no matter how many times they knock us down, we will get back up. You know, I feel like I will die standing, because it's just in me to fight, because if not, I will die. And it's very hard to see my fellow peers or people that are living with this condition pass. It traumatizes me every time, over and over. It doesn't get better in that aspect. So we do have to seek mental health, because we have a lot of traumas. And what happens when a person gets put in the cracks of the health system? For example, my partner, recently diagnosed, not a long-term survivor like me, but has mental health illness, a very severe mental health situation. We have kind of like the same backgrounds. For 1 year, and I'm a witness because I was a treatment advocate for them, try to get access to mental health for severe mental illness, and they didn't listen. They didn't. So what happens if a person has mental health issues or severe mental health issues and they're not medicated? They will go on drugs and self-medicate because they can't take it. You add that HIV to that, you add trauma to that, and what happens is chaos, because they're not going to adhere to HIV meds. And one of the things that I tell these doctors is that we are more than a viral load and CD4 count. Okay, they have to do special assessments on all of us and try to work together as a team, because if they do not take care of our minds, because our minds, it's not an easy thing what we're going through. We like Porchia, I believe, said it. We may, you know, or Cece, or all of us, I think, have said it. Even though we look strong, and thank God we don't look like what we've been through, and so many things. The reality is that, and I'm sorry for cursing, but HIV and AIDS is a bitch, and it will always be a bitch. It's not an easy thing, and we have to carry with that burden. And as you age, it does not get easier, because that's the truth, and that's the fact. We're aging with it. We're aging faster. Our bones, our pain in our bodies. You know, we could become dependent to painkillers, which is another thing, another issue in itself. I just got off a 19-year opiate dependency, which was one of the biggest battles, but I did it because we're all strong and we could do it. So we have to keep our minds healthy as best as we can. And when we see someone that is really, really needing help, and that no one is paying attention to them, and they just leave them there with their mental illness, and they're not adhering, and they're sleeping maybe with unprotected and giving HIV to others, you know, unwillingly or willingly, who knows? You know, we have to help those. We have to help each other, because if we don't, we're lost.
Thank you, Maria. There's a lot of, you know, great points that you talked about, and and that actually is something we saw a lot from, you know, a survey and talking to people. I mean, mental health, you know, not addressing mental health issues can often lead to stopping treatment or falling out of care, and so, I mean, and a lot of other, you know, things. So it's really important that we are addressing the barriers and making sure that this is, you know, wrapped into the care system for HIV. So I know there's a couple other people, but Ariana hasn't had a chance to speak yet, and she's got to sign off soon. So I just wanted to invite you, Ariana, to talk about, you know, whether it's this or some of the topics we've already talked about, or something that we're moving on to just to chime in before you go and kind of talk about some of this and your experiences.
No, thank you so much. Also, I can continue talking about the mental health issue and the stigma, right? Because it's very important for us, persons living with HIV and also doing advocacy work or working in the community or working in some agencies who helping others living with this condition, and educate people who they are working in the mental health, and also providers and clinics and health providers, right? The whole things, because the whole system, because as a transgender individual, if everybody and the other communities, they experiment or they pass discrimination in health system or mental health, imagine trans Latinas or trans people who they never have access. 49% of the transgender individuals there don't have insurance, right? Or they are and also close to 47 or 48% of the transgender they left the HIV care in the first year, or they returning in care. So it's very important. But also we are not want to have a face of the victimized about this and no, I pass discrimination. I think we have to give the tools. That's why the Well Project and also Ariana Center, they are always commitment and give training to organizations and give a webinars like this to break the stigma and educate to others. Also, my agency is working tenaciously with the University of Houston and the Compass Initiative, specific to provide services to mental health in the South. And we give trainings to people who they are management or give services to transgender, provide services to transgender people or any risk group. We're going to provide training, cultural competence, and a homeless institution. What is very important, providers who they receive Ryan White fundings, is very important who they understand us, not just the medical aspect, but the social aspect and also the personal aspect. So it is very important to working in the healthcare stigma, and especially in the mental health stigma, and working with programs and projects they are really working, like I told you, the Compass Initiative, BIP, who we're working right now. We just canceled it for the coronavirus and the COVID virus, but we're going to have a big open and release anti-stigma, HIV anti-stigma campaign, exclusive and designed exclusive for people in South Florida. And this kind of initiative of BIP, of other organizations, Southern AIDS Coalition. I know Gina Brown is in one of the panelists, and it's very important to remark these kind of agencies and foundations who did really working tenaciously and support the work of all transgender, trans Latinas, and people living with HIV in the South, and women living with HIV, and especially like this, the Well Project, who is always so nice join and participate in these kind of webinars.
Yeah, those are a lot of really important parts, and many people aren't really even aware, of some of these issues. And so, yeah, you brought up, a good point, because a lot of these conferences are getting canceled or going virtual. So it's going to be, in support groups and in gatherings for people living with HIV, where we find support are kind of a bit tricky at the moment with everything going on with the coronavirus. So, which is, extremely scary, and we're seeing how, people are being stigmatized and treated. So it's very real for people who've been working in HIV for so long and living with HIV. And but I just want to say that in some ways, the Well Project is well equipped since we're largely online and we've got all our resources, and we you know, can potentially use this type of platform and the webinars to continue to come together and be able to talk about these topics and hear from people and work on strategies and different educational initiatives to, you know, we'll continue to try and use this platform to do that. So I know, Ciarra, you were going to talk about this too, and then we're going to touch a little bit about, like, just really briefly maybe about some self-care tips. And then we wanted to talk briefly about You Equals You. So that's what we have left, and we have about 10 minutes. So,
okay, real quick on the mental health.
Yeah.
Okay, so yes, although it is very stigmatized in my community as well, as I just put in the chat, like if my mental health wasn't addressed, I wouldn't be able to address any of this HIV care. From someone that has a past of self-inflicting pain and harm, that is like one of my first go-tos, is to stop taking my medicine, because screw it, eventually I'll die. But being able to stay in therapy has, I don't know, I use that as a form of self-care because I need it. I need to be able to keep all of these things in line. As I said, this is a daily battle for me, and it's just one of my things that I use for self-care. And because I'm someone that didn't catch it at birth, I got it when I was like 20, just understanding that HIV was more of a symptom versus, you know, everything else that was going on in my life. But, you know, at the top, we can see the HIV and we can see the herpes, but there were so many other things underlying those diagnoses. So I don't know, the poll just came up, so.
No, go ahead. I just figured I would go in the background. Keep going, thank you.
But that is, that's all I have to say anyway. But mental health for me is so important, and we can talk about it and not be ashamed of it. We all have things that we're going through. So that's all.
Thank you. Yeah, it is really important. And I think Porchia was going to speak a little bit to this, but we're since out of time. But I'll just mention that, you know, what she wanted to bring up, and you're welcome to chime in. But, you know, in many, you know, cultures, it's very, and Ariana spoke a little bit to this, but in Mejia too, that it's stigmatized to think about accessing mental health. And so just kind of that is another barrier to having people get into mental health care. Okay, so I did launch this poll, and so just to kind of get a sense from people what type of self-care they practice, and so it's multiple choice, so I'll give it just another 10 seconds. But it's good to hear from people what they do. And, you know, and I've seen that kind of, especially like through a girl like me, that kind of have a ripple effect when people start talking about things they're doing around self-care, whether it's getting into the gym. I know, Mejia, you know, talked a lot about that, you know, using different things. Vicky's was one of our CAB members who's been a long time, talks about gardening. So there's just a lot of different ways, and when people see that, it kind of sparks ideas and helps. So I'm going to share the results of this. So reading and writing and spending time with friends, family, and partners are at the top of the list. I mean, the top of the rankings here, and also eating healthy, exercising, rest, accessing mental health support, all over, you know, pretty high up in the rankings, gardening, art, and other. So yeah, so there's a variety of things to do. Not everyone can do everything, but if you can try and focus on the one thing that you can get in at least a few times a week, and do that, it's really important to keeping your head in a good place. Okay, so I may skip talking about this and then move on to the next thing, because we just want to make sure we get it in. We only have a few more minutes. So You Equals You is the next topic. If we have time, we can get back to talking a little bit more about self-care. But in our survey, we wanted to hear from people about how familiar they are with U equals U, the messages around undetectable equals untransmittable, the confidence they were in the science behind the U equals U messaging, the impact it had on their lives, and then one question that was more about like where they heard it from. We asked that question. It's not pictured here, but if they heard it from their healthcare provider. So as you can see from this graphic, really a lot of people, 62% extremely familiar, 23% very familiar. So we're talking 85% who are really familiar with the messaging. And also a large percentage, most who are, either extremely or very confident in the science and knowing, how to speak about U equals U. Also a very high percentage who had a really significant or tremendous impact, positive impact on their lives, knowing about U equals U. But all that, and then we see that only about 1/3 of the respondents, and these are all, again, women living with HIV, that heard about it from their healthcare provider. So, so I'm going to just launch our last poll here and hear from you all if you heard about U equals U from your healthcare provider. Because having this information is really important because, while our main focus is providing education to women living with HIV or seeking to, find information around prevention or around HIV, we also do have access to healthcare providers and letting them know that, it's a barrier that people are not hearing this. So, all right, I am going to end the poll in just 1 second. Okay, I'm going to share results. So of the yes and no, so we're like, it's, more than half of the people who heard about it from their providers, double the people said no. And there's, 20% said it's not applicable, and then 10% said they didn't recall. So again, it's pretty consistent with more people not hearing about it from their providers than hearing it. And so this is an issue that we need to continue to shine a light on. I know that we're running out of time. And so I don't know if people, we can keep going if people want to stay on. I know some people are going to be jumping off, but I just wanted to, as you heard in the beginning in the intros, many women who are part of our community advisory board are also highly involved in the U equals U as ambassadors or founding steering committee members, and really help kind of shape some of the direction and how the messages has gotten out to different people. So there are a lot of experts that can weigh in here. One thing I just wanted to say, you're kind of in a non-US setting, and we haven't heard from you for a while, so I just wanted to give you a chance about, how U equals U has impacted your life and in getting out the messaging, where you are in Nigeria. If you are able to unmute, Bose, you there? I know the connection.
I'm here.
Okay, great.
Can you hear me? Can you hear me?
Yes, we can hear you.
Okay. For me, talking about U equal U, I know the first time I talked about it in the clinic, I was actually asked not to talk about it because it's so funny. I've been undetectable since 2003. October 10, I started ARV, and just 2 months down the line, I was undetectable. And when the campaign on U equal U started, I tried to educate people around me. And I started from the clinic where I had treatment. I was actually shut down I was told not to talk about it because the fear of the healthcare provider is that when people know they are undetectable, then they will start having unprotected sex. And I try to educate them that you know what, knowing the fact that I'm undetectable and I cannot transmit HIV has empowered me a lot because it helped me to stay on treatment and to help. It also helped me to adhere to medication. So that is that on EU Equal You. And when they started the campaign in Nigeria, the awareness is not that much. People still don't understand what EU Equal You means, what it stands for, and the impact of EU Equal You on treatment, on HIV treatment. For me, I think I need to share about my experience with the Well Project. Is that it, Krista?
Yeah. Oh, well, we're at time, so I'm gonna hand it over to like if either Maria or Winona want to chime in on you with you. But before I do that, because I know people are logging off, I just want to say thank you if you have to log off to everyone. Our panelists are amazing. I know Gina already left. Unfortunately, I didn't get to say goodbye and thank you, but thank you for sharing all of this, and I think it's having a huge impact. We're going to share the chat and the recording of this. So yes, but I will thank you for sharing that, Bose and Maria or Winona. Do you want to quickly also just talk a little bit about your experience with You?
So mine, I kind of briefly talked about it with the self-stigmatizing, being diagnosed and not being informed about You, which led me to make a decision, a life-altering decision that I really regret now, which is tying my tubes and not being informed by my provider. And so that's one of the main things that I really like to speak about, and I love the fact, the science behind You, because with that, I am now, once after marriage, have decided that I will get my tubes untied so I can have another child. So just the fact of people who still believe people who living with HIV are not able to have children or to basically have a life in that aspect, You dismantles all of those things.
Thank you. And actually, I have a question that came through. And I'm going to just ask that really quickly. I wasn't aware. So, one, it's related to the stigma in the healthcare setting. What is the biggest theme of HIV-related stigma that you experience in the medical setting? You know, like what type of? I mean, I know Gina talked about pregnancy, and Winona, you were mentioning that as well, and obviously you just spoke to that a bit. Are there other kind of, you know, I mean, Gina also spoke to kind of people not wanting to engage with her. Anyone else have any like thoughts on kind of experiencing stigma in healthcare setting?
Yes, this is Maria. Well, I could recall stigma from the early 90s, let's say 91. Again, as a teenager, going in the doctors, sometimes the emergency room, because obviously there was no medicine. There was not even no viral load test or anything. And just, you know, every time I would get sick, obviously I would think, okay, I'm dying, because that's how it was back then. And went to the emergency room with my mom, which always would go with me to my every doctor's appointments. And she's my rock, my everything. And went into the emergency room, disclosing very quietly in Colombia, you know, I have HIV or, you know, AIDS, because that was my diagnosis. And seeing the doctor look at me with eyes of horror, like freaking out. And they would say, because it happened a few times, hold on, I don't know how to handle these. I'll be right back. Sometimes waiting up to an hour in the office, and then all of a sudden seeing another doctor come in and putting 2-3 gloves just to check, you know, my lungs, you know, with a stethoscope or things like that, that made me as a teenager feel so horrible. made me feel like a biohazard because that's what we were seen as. They did not want to touch us. And, you know, I know that it still happens in many places around the world and in the USA. I know that for a fact because I've had nurses and doctors that are living with HIV that don't disclose, you know, for personal reasons. They practice universal precautions, but, you know, they hear their colleagues, what they say about us. Also with the police force, you know, officers in there that have told me as well that they don't disclose because of the things that they hear themselves from their from, you know, their peers. And this is a horrible thing, and stigma continues, as I said in the beginning, as we all said, and we have to, I don't know what else we could do but just to continue pounding the message. And as far as U equals U, I've been with them since 2017 as their national and international steering committee. I didn't jump aboard the first year that it started because I represent many things and I cannot put my name in something that I didn't know for sure. So I researched for a year, I observed, and I can't go against science. And it basically, the self-stigma was that I didn't want to believe it wasn't infectious. And by any means, I'm not saying that we're going to stigmatize people that are detectable, because that's a problem. You know, I was detectable for 10 years. So it's not about that. It's about setting us free. It's about knowing the truth. And it's very sad that to this day, with all the information that we have, not even one doctor has ever told me anything about undetectable equals untransmittable. What they tell me when I question them is that in Miami and Broward, here in South Florida, we are number 1 and number 2 in HIV rates and HIV infections, and that they cannot really talk about that with their patients because they're seeing a uproar of STDs that are resistant to antibiotics, and that they feel that they're not responsible enough. I think that that's a disservice, because the people that we promote U equals U with the facts and with science, with the NIH, with the CDC, with WHO, with United Nations, all of them, because it's not us that are saying this is science. But what I tell them is, I have seen it with my own eyes. When you give the person the incentive of being undetectable and not transmitting the virus to your partner, which is such a huge burden that I went through for many years, you know, they have the incentive to take treatment and to take their medication. And they're so happy when they write me and they say, Maria, I am finally undetectable, you know, and it's like a goal for them now. So for a provider not to be doing this, it to me is negligence, period.
Thank you. Yeah, I agree. So so it's one of our big tools around fighting stigma. And I mean, we need to mention that it's also it's fighting general public stigma, you know, by having this knowledge. It fights self-stigma, but you know, at the same time, it's used to really advocate and change policy for access to care. And so that's something, and one thing that we always are trying to, you know, in terms of working on the U equals U in education, is to always make sure that we're not discriminating against someone who, you know, may not have an undetectable viral load, but working to see how we can, you know, provide whatever tools and use this to help people get access to care. And so we are, you know, very aware that, you know, for a lot of people, it has, you know, a very positive effect, and we need to always make sure to see if, you know, we can use some of the tools through U equals U to help people, you know, get better access to medication. So I know that we are almost 10 minutes over time, so I knew we had a lot to talk about, but I really appreciate, I mean, I want to say thank you to all the panelists who are still on and for spending your time with us today, and also to all the attendees who've been part of this and engaged. And we'll send out a notice to everyone when we have this all up on our website and loaded to YouTube so that you can share it with anyone else. So thank you, and happy National Women HIV Women and Girls HIV
AIDS Day.
Day. Yeah, NWGHAAD.
Which is every day.
All right. I love you guys, and thank you so much.
Bye, guys. Adios.
Bye.
Talk to you guys later.
Bye.
How do I read?